welcome back. So for today's session, we are going to focus on the upper portion of our leg. We're going to tune into our quads, which is going to also incorporate that inner and outer thigh. So those will be our areas of focus today. Some pieces of equipment that you might want to grab to help you do that would be, say, your stick roller. Stick rollers work really well. Your foam roller could work. A couple of balls in a bag or a sock works really great. And you might even want to grab that gua sha or that wrench as a substitute, because we can do some gua shaing down around the knee. So those will be kind of our myofascial release tools as well as our hands, but you know, we have those with us perhaps at all times, and so you can use your hands as well. All right, so before we get started, we're going to do just a little bit of warming up, just a little bit of stretching of the area. You can think of this as kind of your test to just see how you're feeling, and then we'll do a little deeper stretching at the end. So some test, retest. So starting with just a brief quad stretch, maybe standing up, holding onto the wall. If you can't actually grab your foot, no worries. Just leaning it up or maybe setting it on a chair behind you, just to lengthen and open through the quad muscle. We'll take, maybe 30 seconds, 20, 30 seconds. It doesn't have to be a super long stretch at this point. We're just kind of loosening things up, warming things up. We'll switch that over to the other side. I could also actually use the wall, right, as my brace. Bring my foot onto the wall if that works for you. Lots of different ways to stretch our quads, and we'll get into some deeper ways at the end. But just to warm the area up. Another breath or two here. Then we'll come into our inner thigh, just kind of squatting down into this goddess pose, and a little bit of moving. So we get a little bit of loosening into the hips. Nice. Your hands can come to the floor, they can be on a chair, you can stay up here. So this is some movement. Really feel loosening of the hips in general. And then if you wanted to come into a little bit deeper inner thigh stretch, coming into a straddle, shifting side to side again, loosening up the hips as I hinge forward, seeing how that feels down the inner thigh. A few breaths here. And then coming on up, bring one leg forward, we'll step our other leg across. Hug in with your opposite arm. So if your left knee is pulled in, you'll hug in with your right arm. Pull nice and tall. Press into the sit bone of the knee that's lifted. Pull through the crown of the head. So we're starting to stretch. It's going to get into your hip a little bit as well. Remember, our body's very interconnected. But you'll feel that coming up through that outer thigh a little bit. You can add a twist if you like. But for the purposes of this stretch, what we're mainly focusing on is sitting nice and tall. Pulling that inner thigh in towards your body so that you're opening up the outer thigh. And release, and we'll take that into the other side, so across the opposite foot over. Hug in, set nice and tall. Relax the shoulders. Remember, you don't have to stretch before and after. You don't even necessarily have to stretch at the same time that you roll. They're both just awesome methods for releasing tight fascia, muscles, right? All of that tissue in our body. And they can go really well together. We're just doing a little before and after for that test, retest. And even right here, just noticing if one side of your body is a little tighter than the other. So my left side, I feel the stretch way more than I'm feeling it on my right side. And then I'll release, and we're ready to get into the actual rolling of the body. So again, we're going to focus on kind of the quad, the front, and the outer, and the inner. Now I find that these areas of our body are my go-to when I'm feeling any kind of pain in my knee. Because when this part of the body is tight, it's going to pull on what it's connected to behind the knee. But you know what I'm going to say. If in doubt, get it checked out. So if you do a little bit of rolling, the knee pain's still there, or you've done something where you're like, I've injured my knee, always get things checked out, because there are other things that can be going on. So you could sit in a chair for this part, you could sit on the floor. I'm going to show you different ways to massage the quads, and you can choose. You can do all of it, you can do part of it, you find what works best for you. But a stick roller can work really well for the quads. So I just start by massaging up and down. Great, and we are working the inner outer thigh and the top of the quad as well. So I can move more to the inner side. And I can move more to the outer side. Now we do have our IT band that runs right down the center of our outside of our thigh. That can be very tender, especially when we get into the rolling on the foam roller or the balls of it. So listen to your body, right? You don't torture yourself. Back off. So a lot of times when I'm massaging my IT band area, I use the stick roller because I can control the amount of pressure. I also make gua sha. So that's another area, another tool that you can use, especially if the rolling on the balls is too intense. Now you could spend, 5, 10, even probably up to 15 minutes on this area of your body because it is a larger part of your body, larger muscle groups. We're going to go through several different tools, but you could sit right here and use just the stick roller. You don't have to use all the tools. Nice. And we'll do the same on both legs. So we'll go through kind of all the tools on one leg and then all the tools on the other, but you mix and match that any way that you would like. Now for me personally, I know right here I'm always really tight. Remember those areas that you're really tight, spend a little extra time. So maybe I'm getting just a little bit of movement there. So I can stick with this stick roller, or another really great thing to use on my quads, right, would just be my hands. I can give myself a pretty good massage. I like to use my elbow. So for me, again, I know it's right here in this inner thigh. My elbow, with my knee a little bit. Use my elbow, I can use my thumb. This is something that I can do pretty inconspicuously just about anywhere that I am. And I can feel little knotted areas. So you feel those little knotted areas, you feel a little crunchiness, as I like to call it. Really get into there. Loosening that up. Now it's a little harder to use your elbow on the outer thigh just because of the position of our body. I can use my thumbs. Down. Now gua sha tool, again, I like to use the gua sha or the handy little wrench as an alternative. I like to use that in the bonier areas of my body. You can use them anywhere, it's just a matter of personal preference. Because around the bony area I want to apply a little less pressure, and I can do that really well with kind of the gua sha type tool. So ideally, I would want to go skin on skin, but that's a little bit harder to do for this video since I have on long pants. So I'll just kind of go over it, right? You want to put a little lotion, put a little oil on the area, and then take your gua sha tool, and you can just scrape around those bonier areas. Now, as I come kind of off the knee bone more into the muscle tissue, I can apply a little more pressure. So you really want to do this skin on skin. You're going to have way more benefit. I mean, any of this is great skin on skin, or not really skin on skin, but tool on skin. You can really kind of come along those outer edges of the knee. And I can even go over that knee joint, patella, and right below it, all around it. I could come behind it. And then as I'm more in the medial area, I can apply a little more pressure. So just using judgment, the more that there's bone, right, a little lighter, the more there's tissue, fascia, muscle, right, I can apply a little bit more pressure. This is kind of nice right here. I found a little tight groove, so I'm applying a little bit more pressure and just kind of scraping back and forth over that. Again, experimentation, right? Your every day is going to be a little bit different. What works for me may not work exactly for you because our bodies are different. So a little bit of experimentation, remembering kind of those rules, right? If it does not feel like there's something good coming out, it feels sharp pain, it's taking your breath away, it's making you feel angry, like you want to throw something, you want to scream, right? Back off. Try a different tool, try a different method, go to a different part of your body. Rules of thumb, right? This may feel really good right here, but maybe it's a very small area that I'm sticking on, so a few minutes, right? And then I want to move in because I want to bring that blood supply in, I want to loosen things up, but then I want to back away, give it some time to just heal and recover, and then maybe I come back to it the next day. Also active injury, right? Maybe I've actively sprained, twisted my knee, I'm not real sure what's going on. I wouldn't recommend jumping right to gua sha in the area or rolling in the area. I would do that ice, elevation, rest, ice, compression, elevation. See your doctor, because we don't want to make something worse. All right, so those are some of the methods that I can do seated, right, using a stick roller, gua sha, using my elbow, my hands, or coming more into kind of that foam rolling style. And we'll get the other leg in a moment. I'm going to do each leg single. Is making like a foam roller with a couple of balls in the bag, bigger or smaller. I use both interchangeably. It just depends on how I feel. These feel a little bit more intense. These feel a little less. Foam roller is just a great alternative for that. Works really great on the quads, the inner outer thigh. I like the balls because they travel well. So really any these pieces of equipment you can use interchangeably. Now you could use one ball, but it's going to be pretty intense, a little harder to balance on, but it is possible. So here we have to come over onto our belly. We'll bring the ball underneath the leg, bring down onto my elbows. I have my opposite leg kind of out in a 45-degree angle with my knee bent for a little balance, but it could be straight. On the foam roller, a lot of times, because it's bigger, and I can show you that in a moment, I'll even roll both legs at the same time. It's going to be a little less intense, but it can feel really nice. And I can roll in different positions. I can bend my knee. I can keep it straight. I can stick in small areas at a time, or I can cover kind of the whole distance of the quad. So just like all other areas of our body, I kind of explore the area, and then I stick to the place where I feel like I need it the most. So right here, center of the knee. Now you can look up trigger points. There are kind of specific trigger points in people's bodies. Massage therapists are trained to look for and things like that. But you're gonna know just by rolling. Right? So as I'm rolling here, there's the tender spot. Now when I'm on this spot, I feel some stuff going on in my knee. It's not sharp pain, it's not intense. What it's telling me is, ooh, this is a trigger point, and if I can get this to loosen up, it's gonna loosen up on the pressure that it's pulling behind that knee joint. So what I do sometimes here when I have the two balls, and I'm like, I want a little more, is I just shift my leg. So now I really am only on one ball. And I can take a little deeper pressure right in that spot that I need it. I can even hold. I can floss. Moving the knee. Now I'm incorporating that inner outer thigh, all of it together. So to get more into the outer thigh, I roll a little bit onto the outside. This is where I said be careful of the IT band. So I'm not directly on of in between the front of the leg and the side of the leg. And again, as I find that area of a little more tenderness, I'm going to stay right there and give it a little more attention. Maybe pinning and holding. Moving, and then to come more onto the inner thigh, I can lay on the opposite side. What I do here is I bring the balls up and I pull my knee up into this 45-degree angle, and then I roll kind of on and off through the belly here. Again, I can get more into just one ball or two, and oftentimes here I'll use the bigger balls because, right, they come up higher. It's a little more comfortable. Up and down the inner thigh. So we're not spending a ton of time with any one piece of equipment because we've massaged our front, inner, and outer thigh of our body with using different pieces of equipment, but you could use just the balls, and then you would stay here longer than maybe we are. And then of course, I'm focusing a little more right here on this one little part of my inner thigh that's always really tight. Nice. And then I want to do the same on the other leg. Of course, you know, you balance things out, you do what works for you, but to go through it all on this leg, starting with our stick roller as an option. If you find that you don't really like the stick roller, it doesn't work for you, you don't need to do the stick roller. If you do, getting all around it. I really like to use the stick roller on that IT band because I can control how much pressure. You can do gua sha the IT band also. Pressure. There's my inner thigh spot. I'm always tight. So I do a lot of cycling, so my quads get really, really tight. Usually if I'm gonna have knee pain, that's where I notice it when I'm cycling. And if I just take, 10 minutes per leg, do a nice little roll, clears it right up. Of course, I would get things checked out if it did not clear it up. Same rules of thumb, 5, 10, 15 minutes is the bigger part of our body. We can spend a little bit longer. And you can stick with just one piece of equipment versus two. I'll use the foam roller on this side instead of the balls just so that you can see and demo that. But they both work great. Hands, elbow. I like to take that elbow right into that inner thigh. Be doing this sitting in a chair, so if you're like, gosh, I don't want to get down on the floor, right? Totally 100% set in the chair for this. You wouldn't, lay and massage on the balls or the foam roller. Use your elbow, use your hands, use the stick roller. Use my hands along that IT band as well, because it's going to be less tense, less pressure than the balls or the foam roller. And then just noticing, like I said earlier, my left side's always a little tighter than my right side. I can feel that in that IT band of the left side. So maybe I draw my stick roller back to work on that a little more. And then I'm going to use that gua sha, lotioning up the area, getting around the bony area of the knee. As I come more into the thicker tissue parts, I can push a little harder. Right, I am feeling some kind of crunchiness in here. That lets me know that's an area that really needs it, so you can kind of hear sometimes the crunchiness. Around the knee. I could use this on that IT band. Again, I want to do tool on skin with that lotion to kind of help with that friction. using the balls, or this time I'll use the foam roller for the purposes of demonstrating. So I bring the foam roller underneath, and I told you you could do both legs at the same time on the foam roller. So here I am with both legs on top, and I'm kind of rolling on top of the quads. I can turn my toes out. I can get my inner thigh. So I can get the quad and the inner thigh at the same time on both legs, or focusing more here just on one leg, ready to take the other leg off. Now there are different foam rollers, different brands, different consistencies of the foam rollers, so they're going to feel different based on what they're made out of. We're going to come onto that side. Now here I am right on the IT band. That is a little too intense for me. So I'm going to shift a little more between the front of the quad and the complete side. Now, this foam roller that I have is pretty thick. It's pretty intense. But sometimes this feels like a lot of work too, to massage the quad area, holding yourself up. So that's why those seated positions can work great. And then for the inner thigh, I'm going to turn around so I can demo this a little bit better. But if I lay on the opposite side, bring the foam roller perpendicular to my inner thigh. Come here. Spending, roughly the same amount of time on each leg. But if one leg needs it more, I give that leg more. Get the pin and hold. Pin and hold is going to be fabulous. Be a little bit like, oh, fabulous. But as long as I feel, the intensity getting less, that muscle, just like that, completely give. So that's our biggest part of our upper body. I hit the little singing bowls back there. Biggest part of our upper body, we will, or upper leg, we'll get into the hamstrings in a separate video. But let's take a moment to kind of just stretch that out. So maybe starting with the straddle of the inner thigh. Lengthening through, so we've really loosened up all that tissue. Just a nice stretch. And then this is where we would hold the stretches longer. So 30 seconds up to kind of yin style, 3, 4, 5, 6 minutes. And we'll do a little more stretching afterwards. Maybe coming into butterfly, bring the bottoms of the feet together. Nice and close, so heels are close here. I keep my hands on my feet. I sometimes like to gently press on the inner thigh, not on the knee, calf, right on the bone, right on that inner thigh. I can lean into one side and press the other side away. That even gets into that outer hip a bit. Switching, lean in and press away. Can come back into my outer hip. So earlier I kept my leg long, which I can do again, or maybe with a little bit more flexibility, I can bend my knee under me. I do want to sit down into my glute, pull tall through the crown of my head as I hug the inner thigh into the chest. We'll say definitely on this side, I am feeling that difference. This is my tighter side the first time. I didn't feel, it was a noticeably difference between this side and the other side the first time we stretched, and I'm feeling a lot more release this time, a lot less sensation. We can switch that out. The other side, sit down to the glute. Nice and tall. Again. Just enjoying a little bit of stillness. And then one more stretch for the outer thigh. Bringing the bottoms of the feet back together, but instead of pulling them in close for butterfly, let them have space away from you or into this bound angle. Holding your hands onto your shins, relax your shoulders. My chest is up, and I'm just gonna hinge forward. So this is a great little lengthening stretch of that IT band. And I have a noticeable difference. My left side is always tighter than my right side, but I do feel a little more release than I normally do on my left side, since I did spend some time rolling. I definitely know I could spend a little more time on my left side because there's a noticeable, I'm not feeling any sensation down the right, but I am feeling sensation down the left. And so those are all just good check, recheck, test points to see where your body is needing a stretch. And then we'll finish getting our quads. You're welcome to stand up and take that standing quad stretch again, or we can come onto our side, pulling heel to glute here. Or if you want to just a little bit double duty, coming on to your belly. And you can do one leg or both, reaching for the tops of the feet, lifting up into that bow pose. So this would get your hip flexor, it always get your quads as well. This is a tougher stretch to take, so don't feel like you have to take this one. But I do like it. It really opens the entire front of my body. And it gets into the quads as well. So once again, I hope you enjoyed that. I hope your inner outer thigh, your quads are feeling a little bit better. And I will see you back here soon. Have a great one, everybody.